Hey, welcome to my audio visual research presentation. My name is Gabby Loftus, and I'm presenting my research that I have done on cannabinoid therapy within veterinary medicine. This is a topic I'm extremely passionate about as I think it has so many different avenues to be able to help our patients. What is cannabis? So, sativa is a plant more commonly referred to as hemp. It has lots of different components such as terpenes, flavonoids, delta 9 tetrahydrocannabinol, which is THC, the psychoactive component, cannabidiol, CBD, cannabinol, CBN, cannabigerol, CBG, and cannabichromene, CBC. Together, all these components have contributed to the pharmacological and psychotropic properties that we know that this plant has. Cannabis has been thoroughly explored in the world of human medicine and has been deemed a magic plant, so to speak, because of all the different properties that it has. Now, with this being said, it hasn't been nearly as explored within the realm of veterinary medicine. A big concern that most people have when addressing CBD or any type of cannabidiol treatment is the legality. Well, CBD is legal. That's the biggest thing. So that leads us to what about full spectrum cannabidiol? Well, as long as it has less than zero point 0.3 delta 9 THC, that psychoactive component, it's legal. Full spectrum cannabidiol contains CBD and all the other cannabinoids that I just mentioned. Full spectrum oil is effective in treating a large majority of conditions, most commonly being behavioral and pain related conditions. With this being said, every treatment can also be done with a non full spectrum cannabidiol, but they are typically more effective as a full spectrum oil. Now, what can this therapy be used for? It can treat dermatological issues. It can help oncology patients with their immune response. It can help behavioral issues such as anxiety. It can help with pain management with arthropathies such as osteoarthritis. And in various neurological conditions such as epilepsy, it can help that too. Which leads us to how do the patients get the medication? Most commonly, it's administered as an oil or a tincture into the mouth, so either onto the tongue or into a cheek pouch. Second most common is a transdermal cream that's applied to the inner ear. Last but not least, and least common, is oral capsules. Most people don't go for the oral capsules because the tincture is the easiest. Now, common side effects. With the tincture, most patients would like hypersalivate, lick, or shake their head, and that's due to the association of the taste, not actual side effects from the CBD. Um, Now, in a few cases, there were increases in ALT and ALP, which are liver markers, but none of those were deemed clinically significant as they had no clinical signs, and those enzymes typically return to normal after a couple of weeks. Clinically speaking, most common signs were GI upset, such as diarrhea and vomiting. And in one study, it was found that a patient developed erythema, which is just like a redness of the skin in their inner ear, and that's because they were receiving the transdermal cream. So, how in the world does cannabis work? I just told you so many different ailments that cannabis can treat, the side effects it can cause, how it gets administered, and it all comes down to how it works. This is my favorite part of cannabis sativa. So the endocannabinoid system, also known as the ECS, is found in almost every single living thing. All vertebrates have it, and a large portion of invertebrates have it as well. The endocannabinoid system allows us to use cannabis sativa as more than just a plant. We can use it as a medicine, and that's because our bodies have these receptors for the cannabinoids built into it. Just as alcohol acts on the GABA A receptors, cannabinoids act on endocannabinoid receptors found in our bodies. But it's even cooler because it's not man made, it's not synthetic, it is 100% natural, and it has the ability to heal. Now, the next few cases that I'm going to be talking about are some case studies. This is about discoid lupus erythematosus, which is a common autoimmune skin disease. This particular one is focusing on canines. So, in this case, conventional treatments are typically corticosteroids, which can be effective, but they often have negative side effects, such as elevated liver enzymes and breakthrough skin lesions. So, it doesn't necessarily treat the problem and it has negative health impacts. So on this one study, sorry, excuse me. A patient showed significant improvement in their skin lesions and liver enzyme levels after starting cannabis full spectrum oil. And after a year, he remained clinically stable on a low dose of full spectrum CBD rich oil. No evidence of DLE reoccurrence was observed, and his liver enzymes stayed at a normal level. This case, in and of itself, advocates for the use of cannabis therapy as a viable alternative or even a complementary therapy for patients with DLE. Now, in equines, crib biting and wind sucking is a behavior that they typically exhibit when they're under severe amounts of stress or they're understimulated. In this particular case, it was a 22-year-old mare with a 15-year history of windsucking and crib biting. They had tried multiple other things to break this behavior, such as medications, stimulation, lots of different things, and it wasn't helping her. She was beginning to have uneven wear and tear of the erosion of the upper and lower incisor teeth. She had poor body condition, being at about a 2 out of 9, and she had a very, very thin muscle layer. Well, after a 30-day treatment with CBD, she stopped crib biting. She stopped wind sucking. Her body condition score improved from a 2 to a 4 with significant increase in her muscle and fat deposits. After the CBD therapy was discontinued, those behaviors did not restart. This case is huge for veterinary medicine because not a lot of studies have been done on farm animals, equines, bovines, ruminants, all those guys. And for these behaviors to completely stop under CBD therapy is incredibly awesome and just is a huge indicator that we need to look more into it. And I'm sure y'all remember whenever I said that crazy word arthropathies. Well, basically, it's pain. It is joint pain, so it falls under arthritis, osteoarthritis, all those different things. Well, in these two cases, a 10-year-old cat presented with a 13 score of the Musculoskeletal Pain Index, FMPI. Um, well, his pain decreased to a 5 after being treated with full spectrum cannabis oil, and his owner stated that he got a large amount of his quality of life back. And as far as canines go, there was a study done where they examined the synovial, which is the joint fluid from the hip and stifle joints. The researchers found that certain receptors from the endocannabinoid system were being released more prominently than others. So, the whole point of this study is to suggest that if we can administer the agents that act on the receptors being released, that we can reduce the pain and inflammation in our canine friends. So, in conclusion, Cannabis sativa is a plant that has hundreds of uses to both humans and animals alike. Cannabis is highly stigmatized, and due to that, it is understudied, as its homeopathic remedies do show promising results. I hope you guys enjoyed this presentation and that you learned something new.